my name is Amira binti Muhammad Yaqub with the number matrix given DPC 09220098. So, we'll be presenting about chickenpox. Let's go. So, chickenpox is a highly contagious disease caused by the varicella zoster virus, which is VZV, like rash among other symptoms. The rash first appears on the chest, back and face, and then spreads over the entire body. Chickenpox is an airborne disease which easily spreads via human to human transmission, typically through the coughs and sneeze of an infected person. The incubation period, which is 10 to 21 days, after which the characteristic rash appears. It may be spread from 1 to 2 days before the rash appears until all lesions have crusted over it. It may be spread from 1 to 2 days before the rash appears until all lesions have crusted over. It may also spread through contact with the blisters. Those with shingles may spread the chickenpox to those who are not immune through contact with the blisters. The disease can usually be diagnosed based on presenting symptoms. However, in unusual cases, it may be confirmed by polymerase chain reaction, which is called PCR, testing of the blisters fluid or scabs. Testing for antibodies may be done to determine if a person is immune. People usually only get chickenpox once.
Assalamualaikum and hello everyone. My name is NUR'ATIQAH binti Muhammad DPC 09220072. I'm gonna continue about the introduction of chickenpox disease. Since its introduction in 1995, the varicella vaccine has resulted in a decrease in the number of cases and complications from the disease. It protects about 70 to 90% of people from disease with a greater benefit for severe disease. Routine immunization of children is recommended in many countries. Immunization within 3 days of exposure may improve outcomes in children. Treatment of those infected may include calamine lotion to help with itching, keeping the fingernails short to decrease injury from scratching, and the use of paracetamol, acetaminophen to help with fevers. Chickenpox occurs in all parts of the world. In 2013, there were 140 million cases of chickenpox and shingles worldwide. Before routine immunization, the number of cases occurring each year was similar to the number of people born.
Assalamualaikum and hi everyone. My name is NUR'ATIQAH binti Muhammad Juraimi. My matrix number is DPC 09220042. Today I would like to talk about the cause of the chickenpox. So, varicella zoster virus (VZV) causes the chickenpox infection. Most cases occur through contact with an infected person. The virus is contagious to those around you for 1 to 2 days before your blister appear. VZV remains contagious until all blisters have crusted over. The virus can spread through saliva, coughing, and sneezing. You also can contact with fluid from the blister.
Assalamualaikum. My name is Hidayah binti Muhammad Ismail. My matric numbers are DPC 09220062. For my part, I will explain about sign and symptom of chickenpox. First of all, the classic symptom of chickenpox is a rash that turns into itchy, fluid-filled blister and that eventually turn into scab. The rash may first show up on the chest, back and face, and then spread over the entire body, including inside the mouth, eyelid or genital area. It usually takes about 1 week for all the blisters to become scabs. Other typical symptoms that may begin to appear 1 or 2 days before rash include fever, tiredness, loss of appetite, headache, weak sight. Besides that, some people who have been vaccinated against chickenpox can still get the disease. However, they usually have milder symptoms with fever or no blister or just red spots, or mild or no fever and are sick for a shorter period of time than people who are not vaccinated. But some people who vaccinated get chickenpox may have disease similar to unvaccinated people. Thank you.
Hi, my name is Sharifah Shafia binti Sayyama Zaid. My DPC number is 09220130. I will talk about who is the most likely to get a chickenpox. Usually, chickenpox is most common in children under the age of 10. Who are the most likely to get chickenpox? The virus spread easily from people with chickenpox to others who have never had the disease or never been vaccinated. If one person has it, up to 90% of the people close to that person who are not immune will also become infected. The virus spreads mainly through close contact with someone who has chickenpox. Who is immune to chickenpox? At least 19% of adults are immune to chickenpox because of having had the disease as children. If you have a history of chickenpox disease, you don't need to testing or vaccination unless you are working in an environment where your immune status must be documented, such as hospital. Does everyone still get a chickenpox? Is chickenpox common? More than 95% of American adults have had chickenpox and about 4 million people get chickenpox every year. Since the chickenpox vaccine was introduced in 1995, less and less children are getting the disease. Why do we all get the chickenpox? A virus called varicella zoster causes chickenpox. It can spread through direct contact with the rash. It also can spread when a person with chickenpox cough or sneeze and you breathe in the air droplets. Is there a person who never had chickenpox? What about people that never get chickenpox? While never getting chickenpox as a child may seem like a cause for celebration, the opposite is true. For people that never contracted the childhood disease, a risk still exists for contracting shingles as an adult. Why don't adults get chickenpox? Although chickenpox is often thought of as a childhood disease, adults are still susceptible and symptoms tend to be more severe. However, if you had chickenpox as a child, you are unlikely to get chickenpox as an adult. Can we get the chickenpox twice? It's possible to get chickenpox more than once, but it's very unusual. The majority of people who have had chickenpox will have immunity from it for the remainder of their life. You may be susceptible to the chickenpox virus twice if you had first case of chickenpox when you were less than 6 months old. Can we still get chickenpox after vaccination? Some people who have been vaccinated against chickenpox can still get the disease. How rare is chickenpox in adults? Most people tend to catch the chickenpox virus as a child. 90% of people experience chickenpox by the age of 15 and remember the itchy spot for years to come. The good news is that you are unlikely to catch it again as an adult. And it's very rare for a second chickenpox infection to happen in the same person.
My name is NUR'ATIQAH Nadira binti Muhammad Jaafar, DPC 09220055. My part, I will discuss about transmission chickenpox disease. Varicella is highly contagious. The virus can be spread from person to person by direct contact, inhalation of aerosols from vesicular fluid of skin lesion of acute varicella zoster, and possibly through infected respiratory secretion that also may be aerosolized. A person with varicella is considered contagious beginning 1 to 2 days before rash onset until all the chickenpox lesions have crusted. Vaccinated people may develop lesions that do not crust. It takes from 2 to to 21 days after exposure to the virus for someone to develop varicella, based on studies of transmission among household members. About 90% of susceptible close contacts will get varicella after exposure to a person with disease. People with breakthrough varicella are also contagious. One study of varicella transmission in household setting found that people with mild breakthrough varicella who were vaccinated with one dose of varicella vaccine were one-third as contagious as unvaccinated people with varicella.
Hi, Assalamualaikum. My name is Adana Mansara. My battery number is TPC09220087. Today I want to discuss about prevention of chickenpox. The best way to prevent chickenpox is get the chickenpox vaccine. Everyone, including children, adults and adults, should get 2 doses of chickenpox vaccine if they have never had chickenpox or never vaccinated. Chickenpox vaccine is very safe and effective at preventing the disease. The most people who get the vaccine will not get chickenpox. If a vaccinated person does get chickenpox, the symptoms are usually milder with fever or no blister. They may have just red spot and no or no fever. The chickenpox vaccine prevents almost all cases of severe illness. Since the chickenpox vaccination program began in the United States, there has been over 97 decrease in chickenpox cases. Hospitalization and deaths have become rare.
Hi, my name is Adila Binti Ruzaidi. So, I will explain about treatment at home for people with chickenpox. There are several things that you can do at home for help relieve chickenpox and prevent skin infection. Calamine lotion and cool bath with added baking soda, uncooked oatmeal, or colloidal oatmeal may help relieve some of the itching. Try to keep fingernail trim short and minimize scratching to help prevent the virus from spreading to others and to help prevent skin infection. If you do scratch or blister by accident, wash your hand with soap and water for at least 20 seconds. Do not use aspirin or containing product to relieve fever from chickenpox. The use of aspirin in children with chickenpox has been associated with Ray's syndrome, a severe disease that affects the liver and brain and can cause of death. Instead of using aspirin medication such as acetaminophen to relieve fever from chickenpox. Moreover, antiviral medication are recommended for people with chickenpox. They are more likely to develop serious illness. There are antiviral medication licensed for treatment of chickenpox. The medication works best if it's given as early as possible, preferably within the first 24 hours after the rash starts.
Hi, my name is Muhammad Imran Hasnul bin Muhammad Amidi. My matric number is DPC 09220086. In conclusion, chickenpox is a contagious illness caused by the varicella zoster virus. It can be quite serious in adults and people with weakened immune system. Varicella infection or chickenpox is a common illness of childhood. In other words, healthy children under 12 years old. The illness is often mild and can be managed with supportive therapy. If required, antiviral therapy can be initiated within 24 hours of the onset of rash. The most effective way to prevent a varicella outbreak is through universal immunization with varicella vaccine. This strategy not only prevents a severe or complicated form of the disease in healthy children, but it also can serve to protect at-risk children, including those who are immunologically compromised and cannot receive live vaccine. Furthermore, exposure can be managed with varicella zoster, immunoglobulin preparation, and antiviral agent, or the vaccine.